Hi everyone, in this video we'll be looking at the main joint actions as well as the muscles that are contracting and the muscles that are stretching or lengthening and a few common yoga postures. This is an introduction, but hopefully it will give you a chance to think about the movements of specific joints and the actions for specific muscle groups when you're teaching or practicing a posture. In chair pose, you have the following joint actions. The spine is in slight extension. There's flexion of the shoulders. There's upward rotation, elevation, and abduction of the scapula. And there's elbow extension. In the lower body, there's hip flexion, knee flexion, and ankle dorsiflexion. The muscles that are working include the erector spinae, the trapezius, rotator cuff muscles, and the abdominals to prevent an anterior tilt of the pelvis. You're also working your pectoralis major, anterior deltoid, and biceps to stabilize and flex the shoulder joint, and your triceps to extend the elbow. Your gluteus maximus, medius, and hamstrings are being used to flex the hips and knees. And the intrinsic muscles of the foot are being used for dorsiflexion of the ankle. In this posture, there's a tendency to overarch the lumbar area of your back, and you can help correct this by engaging your abdominals and using your hamstrings to draw your sitting bones slightly forward. In standing forward fold, the joint actions include mild flexion of the spine, hip flexion, and knee extension. You're using your quadriceps to maintain the knee extension, and you may use your abdominals to pull yourself deeper into this posture. To maintain your balance, the muscles in your feet contract, and your tibialis anterior, near the front of your shin, helps stabilize your ankles. Your erector spinae, hamstrings, gluteus maximus, gluteus medius are passively lengthening, as are the gastrocnemius and soleus in the back of your calves. If you find that there is tightness in the back of the legs, resist the urge to use the hip flexors to pull yourself deeper into the posture. This can cause tightness in the front of the hip and further prevent the pelvic bowl from tipping forward as we would like. Instead, bend the knees a little bit to remove some of the tension from the hamstrings and allow the spine to release. In Chaturanga, the joint actions include maintaining a neutral spine, retraction of the shoulder blades, elbow flexion, forearm pronation, wrist dorsiflexion, maintaining neutral hip extension and knee extension, and dorsiflexion of the ankle. The serratus anterior is contracting to prevent winging of the scapula or shoulder blades in this posture. The rotator cuff muscles and deltoid are contracting to stabilize and protect the shoulder joint, and the pronators are working to pronate the forearm. Muscles in the hand and wrist are being used to maintain stability and dorsiflex the wrist. The erector spinae and abdominal muscles are contracting to resist lumbar hyperextension due to gravity. The pectoralis major is eccentrically contracting or contracting while lengthening, and the triceps are working. The quadriceps are contracting to maintain knee extension. The hamstrings, adductors, and gluteus maximus are contracting to maintain neutral hip extension and adduction. And the tibialis anterior is working to dorsiflex the ankles. Weakness in this pose typically shows up in hyperextension in the lumbar, where the belly drops towards the floor. Encourage your students to squeeze the abdominal muscles towards the spine in order to assist the erector spinae and hip flexors in maintaining a neutral spine and hips. Up dog. In up dog, the joint actions include spinal extension, shoulder extension and adduction, elbow extension, forearm pronation, hip and knee extension, and ankle plantar flexion. In this posture, you're contracting your serratus anterior to stabilize the shoulder blades on the rib cage and the rotator cuff muscles to stabilize the shoulder joint. The posterior deltoid extends the shoulder joint, and the triceps extend the shoulder and elbow. The abdominal muscles prevent hyperextension of the lumbar area of the spinal column. The pronators pronate the forearm, and the hamstrings and adductors extend and adduct the hips. The quadriceps extend the knee, and the soleus plantar flexes the ankle. In up dog, you want the spinal extension to be evenly distributed throughout the entire spine. So encourage your students to engage their abdominal muscles to prevent hyperextension in the lumbar region. In down dog, the joint actions include upward rotation and elevation of the scapula, shoulder flexion, elbow extension, forearm pronation, hip flexion and adduction, knee extension, and dorsiflexion of the ankle. You're using your erector spinae to maintain a neutral alignment of the spine. To stabilize the shoulder joint, you're using your rotator cuff muscles. To flex the shoulder joint, your deltoid and biceps brachii are contracting. And to extend the elbow, the triceps are working. Pronators allow you to pronate the forearm, and your adductors inside of your thighs are working to internally rotate and adduct your thighs. Your hamstrings and the gastrocnemius in the backs of your calves are lengthening. In this position, it's important to maintain a neutral spine that is neither rounded nor arched. Your ears should be between your two arms. If you drop your head and chest too much, you'll lose the stability in your shoulder joints, and that could lead to injury. Straddle forward fold. In a standing straddle forward fold, the joint actions include mild flexion of the spine, hip flexion and abduction, knee extension, and ankle dorsiflexion. In this posture, your quadriceps are contracting to keep the knees extended, and the intrinsic muscles of the feet are working to maintain the arches of the foot without inhibiting the dorsiflexion of the ankles. The erector spinae, as well as the hamstrings and adductor muscles, are passively lengthening. Although this posture stretches the adductor muscles, it is less of a stretch than it would be if you brought the legs into a wider straddle without folding forward. Since some of the adductors are also hip flexors, there's less lengthening in general to the adductor muscles once you flex at the hips. Squat. In a squat pose, the joint actions include slight extension of the spine and shoulder flexion, elbow flexion, forearm pronation, hip flexion, abduction, and external rotation, knee flexion, and ankle dorsiflexion. The muscles that are contracting include the gluteus maximus and internal hip rotators, which are working to support the external rotation and flexion of the hips. The hamstrings and quadriceps are working to allow for knee and hip flexion, and the soleus works to maintain ankle dorsiflexion. In this position, gravity does the work of lowering the body towards the floor. It's important to remind your students to activate the muscles in their legs in this position to prevent them from collapsing into the joints. Camel Pose. In Camel Pose, the actions of the joints include extension of the spine, retraction and downward rotation of the shoulder blades, shoulder adduction and extension, elbow extension, hip extension, knee flexion, and ankle plantar flexion. The muscles that are contracting include the erector spinae, which extends the spinal column. The abdominal muscles work as they are lengthening to prevent hyperextension of the spine. The rhomboids and levator scapula to adduct, elevate, and downwardly rotate the shoulder. The rotator cuff muscles are being used to stabilize the shoulder joint. The triceps are extending the elbows and helping to extend and adduct the shoulder. And the hamstrings, adductors, and gluteus maximus are working to extend, adduct, and internally rotate the hips. The psoas, pectoralis major, biceps, and quadriceps are all being stretched and lengthened. In this posture, it's important to press the hips forward rather than lean back in order to create more extension in the spine, but to also engage the abdominal muscles slightly to prevent any hyperextension in the spinal column. Child's pose. In child's pose, the actions of the joints include spinal flexion, hip flexion, knee flexion, and ankle plantar flexion. There should not be any strong muscular contractions in this posture. The spinal column is passively lengthening, and the gluteus maximus and medius, the piriformis, and other rotators, the hamstrings, the tibialis anterior, and the muscles that pass over the tops of the ankles are all stretching in this position. Remind students to relax into this posture. If they use their hip flexors to pull themselves into this posture, rather than letting gravity do the work, it can create tightness in the front of the hip joints. Spreading the knees wide or using props can help release into this posture.